We're going to be covering the femoral fracture and stress fracture test now. There's not a whole lot of them, and in general their mechanism is going to be such where if it's a stress fracture that they have been pounding for a long period of time. Typically we see them in distance runners, up in their femoral neck, in soccer athletes, sometimes we see them in others. Now, if you think it is a legit femoral fracture, you are not going to do any of these tests because they are going to be laying on the ground, screaming in pain, and their leg is going to look bad, like short and not bent, or it won't be straight, it'll be bent. Or the femur went like this and it went like this, so you can see that one thigh is way shorter than the other. You will not be doing any of these tests, just observation when we do this. So when we're talking about them, the first one that you can do if you basically suspect a stress fracture is to just take their heel and do the heel strike test, and you can hit their heel, kind of punch it, in which case the vibrations will focus up and they will report pain in a very specific part of their femur and or of their femoral neck or something like that. Occasionally it can actually even go all the way up to their pelvic region. So if they complain of pain in their pubes or their iliac crest or something, that's something to think about. You can also do the same thing and pound on their patella / proximal tibia or distal femur. And the same kind of thing, if they complain of sharp pain, shooting pain, that kind of stuff, really doing any of those things shouldn't result in any pain. They should just sit there and be like, yep, that was weird. But if they do report pain, then that's a problem. The next one is going to be the Fulcrum Test, and there's lots of different ways to do this, but in general, this is the way I like it best. So put your arm underneath theirs because it's gonna pick it up off the table, and you don't want it all the way at the knee, it should be up a little bit. And then I hold on to their other leg for stabilization, and then you're gonna take your far hand and push it on their distal femur, and pushing down, and you can change how high up your arm is if you need to change the fulcrum point. And that, again, if they have some kind of femoral stress fracture, that will also cause pain, and they will let you know fairly quickly that that's going on. And you could potentially have some issues with your acetabulum or in the pubic bone, but in general, these are really going to be specific to femur fractures and more so looking at femoral stress fractures.